DocTalk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Shelley, welcome to the show.
Thanks, Dan.
Shelley Laflin is an associate clinical professor here at the Veterinary Health Center at Kansas State University. I'm not quite used to the names changed
That's
yet.
okay, I'm not here.
So anyway, Shelley, you're a veterinarian, and we've worked together for nearly a decade here at K-State. What are some of the things that you do here for Kansas State, and what kind of your role?
Well, I function very much like a private practitioner here for the Veterinary Health Center, but I always have helpers with me. The senior students come with me on every call that I go out on, and so I'm teaching them just kind of truck side or shoot side what it's like to be a veterinarian.
So it's kind of like the school of cosmetology, that you're taking your underlings out that are going to be future practitioners and trying to get them some hands-on experience while teaching them, you know, how to function as a practitioner.
Exactly, yes.
So not all the time are they going. There's going to be times where you're just going to be the one doing it, though.
Sometimes, yeah. Depends on the crew we have for the day.
Well, and calving season, I think, is one of those things when we start to think about training veterinarians, training producers, farm help, things to that nature. But when calving season is coming up and it's upon us, there's a lot that goes into preparing.
There is, and I think being ahead of the game is one of the best things you can be. The better prepared you are, the less, oh my gosh, where did I put X, or can somebody go get me Y, the less of that occurs.
So let's talk about some of the things equipment-wise or product-wise that you're going to start assembling here, you know, a month or two before you calves start hitting the ground.
Sure, certainly for us, on our ranch, I start thinking, do we have colostrum in the freezer? If we don't, it's probably a little too late for that, so we need to get some good colostrum replacer. And some of the products are good and some of them aren't. Do we have our calving chains, our handles, our calf jack? Do we have that sort of stuff ready? Is the calving barn clean, as draft proof as we can get it? Do we have heat lamps and things like that ready for that time to come?
So you know, when we talk about colostrum, what are the things, the equipment? We need bottles, nipples, mixer, different things to that nature?
Yep, certainly a esophageal tube feeder is always good
Sure.
to have on hand if you have a calf that doesn't want to suck. And then clean bottles, clean nipples. If they're cracked or you know, the little X in the tip of the nipple is too big, maybe just pitching those and getting a new nipple. If the bottle is dirty or has got some, you know, some residue in it, maybe we just pitch that and buy some new stuff if it wasn't cleaned up good the last time we used it. So.
Because the big thing on cleanliness is making sure that we don't get fecal oral contamination and propagate some sort of scours issue within the.
Exactly. Most of these calves that we're treating or that we're giving colostrum to need all the help they can get, and so we don't want to heap any extra stuff on them. So.
Great information. Thanks for watching Doc Talk. When we come back from the break, more on preparing for the calving season with Dr. Laflin. We'll see you here in a minute.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by my friend and colleague, Dr. Shelley Laflin, who's an associate clinical professor here within the Veterinary Health Center. You also ranch.
We do.
And
Yep.
So you have a full-time job, not only with that, but two sets of wonderful twins.
We do have a full plate. We're very blessed.
You are, and so is our family. And so now we're talking about, when we left, we were talking about colostrum, equipment, esophageal tubes, and feeders. And when do you decide to give a calf colostrum?
Yeah, what we want to remember is that we have gut closure almost complete by 24 hours. 90 to 95% closure by 12 hours. So we want to get all of that calf's colostrum requirements into it by 6 hours. So if you kind of backtrack, that's how we tend to think. So most calves should be getting up by 15 to 30 minutes. Most of them should be standing. If they're not up in 2 hours, we need to intervene. And most of the time I probably hedge on the shorter end of that.
Sure.
If they're not getting up, something's wrong. And so we need to intervene and make sure that we either, milk out the cow and get him to suck or tube him, or we use that frozen colostrum or colostrum replacement.
It's amazing how quickly they get up and can suck to get colostrum. You talked a little bit too during the break. We talked about potential, scour vaccine products, oral, parental. What are some of the things that you think about at this point in time?
Certainly, if you're doing parental vaccine, most of that should have occurred 6 to 8 weeks ago in the cow, so that she passes on good immunity in her colostrum. If you're giving a product to the calf, let's say it's first calf heifers or something like that, and you're wanting to boost their calf's immunity, many of those products given orally need to be given prior to the ingestion of any colostrum. And so you want to communicate good with your veterinarian and make sure you've got good instructions on how that product's to be given, so we don't put a $2 or $3 vaccine into them that we've ruined because we just gave colostrum.
Because the colostrum and the passive antibodies can negate or neutralize that product.
Exactly.
Well, so we got the calf on the ground. We've assured the colostrum. Now let's talk about the environment. You talked a little bit about shelter and providing shelter. What are some of the things, preparing that barn?
Yeah, good. If you are barn calving, making sure your calving pens are clean, dry as possible, some fresh straw. It's always best if we can get our heifers to calve on the front end of calving season and the cows after. So just some things like that. If you're pasture calving, then making sure they have good windbreak, they can get those babies out of the wind. If it's 6 foot of snow, we've just got to do something different. Go out there and doze some spots off, some loafing sheds or something to give them a little protection.
Well, I think it's important to know. And, when you start to think about calves, warmth, hydration, colostrum, and Mother Nature will take care of it.
Yeah, nutrition and warmth are the big things we can do for them off the bat.
Cool. Thanks for watching Doc Talk. We're going to take a break here, and when we come back, more with Dr. Laflin on preparing for calving season. We'll see you here in a minute.
Doc Talk, brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson, joined by Dr. Shelley Laflin, and we work here at the College of Veterinary Medicine at Kansas State University. And Dr. Laflin, we are talking about preparing for calving season. And before we went to break, we'd talk a little bit and just mention about having the heifers calve before the cows. And why is that important?
Well, certainly cows are going to have more pathogens that they can carry along and deposit in the area through fecal or mastitis or whatever. The heifers classically are going to have poor quality colostrum. They're going to have smaller calves usually, and so those calves kind of need a leg up, and they need to get first dibs on the clean environment before those cows come in. Just
because the heifers have been exposed to less, their colostrum isn't as potent, they have probably more issues with dystocia, could have, and so you're trying to sort out a lot of different things, and being able to focus on those heifers, clean environment for their calves.
Right, and you tend to get tired at the end of calving season. I mean, checking 2 or 3 times a night gets old, and those heifers are going to need more observation typically than your cows, and so you're fresh kind of on the front end. By the time you've been at it for 60 or 90 days, you're wearing thin.
Not just for the heifers, but also maybe for the people as well.
Yeah, exactly.
So then let's move into preparing. We hear a lot of things about calving systems or moving animals, and the theory is to have cows calve in an area for 30 days, and then you move the animals that have not calved into a new clean environment to continually make a clean environment for these animals to calve in. Thoughts on
Yeah, I think those are good concepts, and they're good concepts to build from. You know, establishing what will work for you and your labor source, you know, you and your wife, or you and your 3 kids, or whatever it is a totally different subject. And so I think implementing some of those standards are a good idea, but remembering not to be too regimental, I guess, and saying I've got to move every 2 weeks, and I've got to have X number of pens, and because in reality that's just not practical for many, many places. Understanding
the theory is important, and when it fits, and you know, it's kind of like everything in a job. You know, as we have time, as we have a chance to progress our system or our farm or our ranch, then things tend to work. But not always are we going to be able to get everything done. So if we're not going to be able to get everything done, you know, we went back to that warm, dry, managing the area that you have.
Yeah, I think just good management and good care of these animals is the best thing. If you get a wet spring in your spring caver operation, then getting those animals to clean, high, dry ground is going to be important, and making sure that they have good, adequate nutrition.
Well, I think you raised some great points, and you know, Yogi Berra has one of my favorite quotes, and it says, "In theory, there's no difference between practice and theory."
Yeah.
But in practice, there is.
Yeah, so. It's a little different when you're on the other end. So.
Thanks for watching Doc Talk. We're going to take a break here, and we're going to come back, and we're going to wrap up discussing preparing for the calving season. We're sure glad you joined us.
Doc Talk, brought to you by Kansas Pork Association, assisting producers and informing consumers.
Hi there, and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Shelley Laflin, and we work here at Kansas State University, and we're talking about preparing for the calving season. And Shelley, one of the things that you know, we get questions about quite a bit is, you know, you're a veterinarian, and I'm going to sit, and myself as a producer, I'm going to call you. I'm going to say, Doc, I got a cow that's calving. We've been up all night checking them and things to this nature. And what are some of the things you're going to ask me as a producer that I need to be ready to answer on the phone?
Right. Usually I want to know, how long has she been progressing? Are there any parts of the calf that you can see? You know, we oftentimes worry, is it breech or a backwards calf, in which case you may not see any body parts. So how long has she been down and pushing, or if she hasn't been down and pushing, how long has she been kind of in that stage 1, walking the fence, up, down,
off by herself,
got a kink in her tail, those sort of things, or you've seen the water bag break. So I want to know those kind of time frame things. And then certainly, have you done anything? Have you tried to pull the calf? Have you been in there to palpate her or anything like that?
So let's talk then. So I say, well, she's been, you know, what are some of the things as far as normal progression when you're talking about has she progressed? About what are some timelines or milestones that I should be thinking about? Or
yeah, usually what I tell our crew is, if you're not getting in her face, so if you can peek through the barn window or through the door and not really disrupt her, flick the lights on and off in the barn, that sort of thing, she ought to make progress every 15 to 20 minutes. So I see the tip of 1 foot, 20 minutes later I ought to see 2 feet or a foot and a nose. Once you get to that stage, the next 20-minute block, I ought to see more of those body parts. Once that stops, we need to intervene. Or if there's no progression made in that time frame, we need
So if we check and there's 1 foot exposed and we come back 20, 30 minutes later and it's 1 foot, we need to get her up. Get her up and get on it. And then when you're talking about the stage 1, I think that's important. As the cow, the water breaks and she's starting to, I feel funny, I'm getting off by myself, and we're going to have this calf, you know, that 10 to 12 hours, so from the time she starts, quite a while, but something that you need to just make sure that you're getting her up and get her to the barn.
Yeah, I think that's the most common thing I hear is, well, she acted like she was going to calve a couple days ago and then never did. And most frequently that's a breech calf or a backwards calf, and it never entered the birth canal, so she never went into stage 2. She never went into that lay down and push and try to have that calf.
Got to keep a close eye on them. How many times a evening do y'all keep track?
We're better at the beginning of calving season. Usually we'll check them about 10 o'clock, and then if something looks like it's going to calve, we'll keep working on that. If not, we'll check midnight, 1 o'clock, and then 4 o'clock in the morning. So.
Appreciate you being on the show.
Not a problem, Dan.
Always great to have you. Thank you for watching the show. Remember, if you want to know more about what Dr. Laflin and I know here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember to always work with your local practitioner. We sure appreciate you watching Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'll see you down the road.